Welcome to Holmes on Health, the podcast where nutrition, fitness, and hormones meet health span, and science meets real life. I'm Dr. Alan Holmes, a recovering emergency physician turned expert in hormone optimization, metabolic wellness, and living life fully optimized. Each week, we dive into the tools, truths, and evidence-based therapies that help you build a stronger body, sharper mind, and more vibrant life. Whether you're curious, confused, or already optimizing, you're in the right place. Thank you for being here. Let's get into today's episode. Hello, and welcome to this episode of Holmes on Health. Going to share something with you that's going to blow your mind. I can take a carnivore enthusiast, a militant vegan, and a macro counting bodybuilder, put them on completely different diets, and get very similar results. How is that? Because while we have been arguing about what to eat, we've been ignoring how the human body actually works. And today, we're cutting through the diet wars to reveal what really matters. Last week, I had a patient tell me, I've tried 17 different diets in the last 5 years. 17. I've done carnivore. I've done keto. I went vegan, tried Mediterranean, did intermittent fasting, you name it. And then he said, in every single one of them, I lost some weight, but I only gained it all back. And by the time I got done with all these different diets, with all the same results, I was more confused than when I started. Does that sound familiar to you? Here's what no one's telling you. The diet industry has turned nutrition into some kind of a religion. And like with most religions, everyone's fighting over the wrong things. While carnivore advocates and plant-based evangelists are throwing studies at each other like they're grenades, they're all missing the fundamental truths that have been staring us in the face for decades. Today, I'm going to show you why the diet you choose matters far less than you think it does. And I'm going to share with you the 3 principles or pillars that matter far more than you realize. By the end of this episode, you're going to understand why some people thrive on a meat-only diet, and while others may flourish on a vegetarian diet. And more importantly, you'll know how to figure out which approach will actually work for you. Let me share the stories of a couple of patients. These aren't their actual names. These aren't their actual demographics. First, there's Sarah. She's a 35-year-old. She's a marketing executive, and she lost 40 pounds on the carnivore diet. She eats essentially nothing but beef, eggs, and some salmon occasionally. Her inflammation markers dropped, her energy soared, and she looks phenomenal. Then there's David. David's 42. He's a teacher. He lost 35 pounds eating a completely plant-based diet. Beans, quinoa, vegetables, fruits, no animal products at all. Now for David, his cholesterol plummeted. His blood pressure went back to normal, and he runs half marathons. Now, according to the internet, one of these people should actually be dying. Sarah's arteries should be clogged with plaque from all that saturated fat. David should be wasting away from protein deficiency. But here's the kicker. They're actually both thriving. Now, why is that? Well, because they both discovered the same secret that was wrapped up in different packaging. The secret isn't carnivore versus vegan. It's not even keto versus high carb. The secret is understanding 3 fundamental principles that govern human metabolism. And once you understand these, you can make almost any diet work. Before we get into those 3 principles, we need to demolish a few myths. Let's start with carnivore, the diet that makes plant-based advocates nauseated and break out in hives. Critics say it's unsustainable. They say that it lacks nutrients, and it's bound to cause long-term health problems. And you know what? They're probably not entirely wrong. But, and this is crucial, for certain people with specific metabolic profiles, carnivore can be profoundly healing. And here's why. If you're dealing with autoimmune issues or severe insulin resistance or food sensitivities, carnivore acts like a metabolic reset button. It eliminates virtually all of the dietary triggers in most cases, while providing complete proteins and bioavailable nutrients. Lacks fiber, yes. For some people with gut issues, maybe that's something, or maybe it's just a feature of the diet. But here's what carnivore diets won't tell you. For weight loss, it primarily works because it creates a massive calorie deficit and it eliminates processed foods. It's not because meat's magical. When you eliminate a whole macro like carbs, which is what happens on carnivore, you're eliminating a significant number of calories from your diet. And we know that fats and protein are more satiating, so you simply don't need to eat as many of them or as often to feel full. Let's talk about vegans for a minute. The research is compelling. A properly planned, and I stress properly planned, plant-based diet is associated with longevity, lower disease rates, and maybe, and don't shoot me, environmental benefits. I know there's people on both sides of that. I might be on the other side. Anyway, it's talked about. But here's where it gets interesting. The magic isn't necessarily in avoiding animal products. The magic comes from what people start eating when they go vegan, meaning more vegetables, more fiber, more micronutrients, fewer processed foods. Again, I am talking about those that do it correctly. I am not talking about people that choose to avoid meat and replace it with bowls of cereal and cookies because they're not animal-based. However, this requires some significant strategic planning if you're going to optimize your protein intake and maintain your muscle mass, especially as we age. This is because the majority of plant proteins are incomplete. They lack some of the essential amino acids, particularly leucine, which is essential for muscle synthesis. Let's move on to keto. Keto promises to turn you into a fat-burning machine, and for many people, it actually delivers. But here again is the dirty secret. Keto works primarily through appetite suppression. Proteins and high-fat foods are simply more satiating. Keto also, particularly early on, delivers weight loss because it's water weight, not because some magical metabolic advantage. When you drastically reduce your carbs, you lose glycogen. And glycogen is like a sponge. So less glycogen, less water. Thus, this leads to sometimes dramatic initial weight loss. What are the real benefits of keto? Well, it stabilizes blood sugars and it reduces hunger. So if you are insulin resistant, pre-diabetic, diabetic, and you are hungry all the time and constantly eating and snacking, keto may be a very good route because it's going to cut down your snacking by making you fuller longer, and it's going to help stabilize your blood sugar levels. So what's the downside? Well, if you are a high intensity athlete and like or enjoy high intensity exercise, it's going to be really, really hard to perform those exercises on a keto diet because of the lack of carbohydrates, at least early on. There are some that are able to become fat adapted after being at it for a while, where maybe this isn't an issue. Let's talk about macro counting, the diet of bodybuilders and Instagram fitness influencers. Now, what are the positives? It is the most flexible approach because it's based on the fundamental principles that calories and macronutrients matter more than food sources. So you can eat anything. You can eat carbs, you can eat fat, you can eat protein, so long as they fit into your macros. That means, theoretically, you could even put Pop-Tarts and cereal in your diet, and if it fits in the macros, you're probably going to still reach your goals. But what's the catch? Well, it turns eating into a math problem. 13 grams of this times 4 calories equals 40 grams of that times 4 calories equals. You're constantly doing math to add up to your macros. You get to the end of the day and you're 32 grams of X short, and you're scrambling to figure out how you're going to get it in before you're allowed to go to bed. It's probably not sustainable long term. Then there is the issue of accuracy, because unless you've got a scale out, is that really 4 ounces of ground beef, or was it more like 5 or 6? How do you go out to eat? When you Google how many calories are in your Chipotle bowl, how accurate is the number that Google gives you? So following these macros and counting them accurately can be difficult. It can be tedious. And to be honest, it actually can create an unhealthy obsession with numbers rather than focusing on hunger cues and food quality. So I mentioned that I had 3 pillars, 3 principles. Here they are. The first one, energy balance. Here's the truth that every diet guru tries to complicate, but you can't escape it. It's called the law of thermodynamics. Whether you're carnivore or vegan or eating nothing but pizza, if you consume more energy than you expend, you will gain weight. And if you consume less energy than you expend, you will lose weight. But this is where it gets a little sophisticated. Not all calories affect the body the same way. Protein calories require more energy to process than carbs and fat calories do. This is called the thermic effect of food. And it means that eating more protein literally means burning more calories. I'll give you an example. If you ate 100 calories of protein, let's say chicken, and you ate 100 calories of rice, which are just carbs, the net is going to be different. Meaning, let's say, and I'm just throwing out numbers, these aren't exact. Let's say that for the 100 grams of protein that you eat, the 100 grams of chicken, it requires your body 20 calories to process that protein. And for the 100 calories of rice that you ate, it only requires the body 5 calories to process those carbs or process that rice. Well, net means that you are only netting 80 calories from the chicken you ate, but you're netting 95 calories from the rice that you ate. So you can see how that works. And over time, that adds up. Here's the practical application. Regardless of which diet you choose, you need to be in a caloric deficit in order to lose fat. The diet that helps you maintain that deficit most easily is the right diet for you. Pillar number 2, protein. This is where most diets fail. When you're in a caloric deficit, which you must be in to lose fat, your body is at risk of losing muscle mass. The reason adequate protein intake combined with resistance training is so important is because it is the only way you're going to prevent muscle mass loss while you are trying to diet and lose weight. Well, how much is adequate protein intake? We're talking 0.8 to 1 gram per pound of body weight daily. So for the 150-pound person, that's roughly between 120 to 150 grams of protein per day. Why does this really matter? Think of muscle tissue as being metabolically active. For every pound of muscle you preserve, it burns calories by just being there. Here's an example I like to use, or an analogy that I like to use with my patients. Think of your muscle mass like it's a furnace. The larger the furnace you have and the hotter it burns, the more fuel or calories you burn. So if you lose a lot of muscle while you're dieting, then you're tanking your metabolism. If you preserve the muscle, then you preserve your metabolism. And this allows you, when you get to goal weight, to be able to consume more calories while maintaining your weight loss. Now, this is why protein-centric diets like carnivore often work really well for people, particularly in the purpose of maintaining their body composition. While sometimes vegan dieters need, again, as we discussed earlier, to be really strategic about how you're going to get your protein in and still remain in a calorie deficit. This is one of the most crucial things I talk about with my patients every day, because it isn't about just losing the weight. There's 100 different ways to lose 30 pounds. I could sew your mouth shut and you're going to lose 30 pounds or more. I could cut off a limb and the scale is going to read less. How you lose the weight is super important, which is why in our clinic, we talk about fat loss, not weight loss. That's the goal. Lose fat, maintain muscle. Or if we can gain muscle, all the better. Because for us, to help someone lose 40 pounds, only for them to gain it all back because their metabolism tanked along the way, I consider that failure. My goal is to help them lose the weight in such a way where they maintain their muscle mass so that they maintain their metabolism and have the best chance of keeping the weight off. And there's just no way around it other than getting adequate protein in. Here's the third pillar: sustainability. The best diet is the one you can follow for years, not just weeks. This is where most people go wrong. They'll choose a diet based on the short-term results that they read about on Instagram rather than long-term adherence. So you got to ask yourself, can you imagine eating only meat for the next 5 years? Can you imagine never eating cheese again? Can you imagine weighing and measuring every single morsel of food that you put in your mouth for the rest of your life? The answers to those questions should guide your dietary choice or your diet of choice more than results you see on social media. So here's your prescription. Not your diet, but a framework to think about this. First, choose an approach that naturally puts you in a calorie deficit without making you miserable. If you love meat and hate counting, you should try carnivore or some other low-carb diet. If you love variety and flexibility, you should try counting macros and see if that works for you. If you have ethical concerns about animal products, you should go plant-based. But for sure, if you do that, prioritize protein. The second, hit your protein target every day. Regardless of the route you go, carnivore, keto, vegetarian, hit your protein target every day. This is non-negotiable if you want to preserve your muscle mass and maintain your metabolism. Third, plan for the long term. Ask yourself, can I see myself eating this way in 2 years? If the answer is no, you should probably keep looking. Fourth, track your biomarkers, not just your weight, but your energy level, your sleep quality, your workout performance, your mood. You should do lab work before you get started. Find out, am I insulin resistant? Where are my cholesterol levels? Where are my inflammatory markers? That will help guide the right diet choices for you. And then you can track over time by doing repeat blood work to see if those numbers are improving. Again, it's not all about the number on the scale. Here's what I want you to remember. The diet wars are a distraction. While people argue about whether humans are meant to eat meat or plants, you can be getting results by focusing on what actually matters: energy balance, protein adequacy, and long-term sustainability. The perfect diet doesn't exist, but the perfect diet for you does exist. It's the one that helps you maintain a calorie deficit, hit your protein goals, and stick with it long enough to see real results. And even more importantly, to maintain those results. So stop looking for the magic. Start looking for what works for you. This episode changed how you think about nutrition. Please subscribe to Holmes on Health. Share it with your friends, someone you think may benefit from the message. And follow me at Alan J. Holmes, MD, for more evidence-based content that cuts through the noise. And until next time, live life optimized.
Thank you for tuning into this episode of Holmes on Health. If you found today's episode valuable, share it with someone you care about. And hit subscribe so you never miss a future episode. Want to get more of our content? Follow me on Instagram and YouTube at Alan J. Holmes, MD. Until next time, here's to living life optimized. This podcast is for general informational purposes only and does not constitute the practice of medicine or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions.